I think what we won that is enormous is we won a national commitment to getting everybody affordable health care. And the bill is not all we want it to be in delivering on that commitment, but the structure is there. We now, for the first time, have national responsibility for making the healthcare system work, and I think that's huge. And I think that's an institutional change and an achievement of a shift in where the responsibility lies can enable us to move forward. So that's what I think of from an institutional perspective. But in terms of to me, the biggest victory is in an immediate people, or almost, not about 4 years, what do we have, 3 years till 2014? Covering better than 30 million people is amazing. It is an amazing achievement for us to do that, to do it with a Medicaid program, as Jim Talon and I were talking about, that we have expanded finally a Medicaid program so that it's no longer covering only low-income people who are considered deserving poor and leaving out working age adults who aren't parents of dependent children. We've finally gotten rid of those welfare categories and have a floor of coverage for everybody below 133% of the federal poverty level, or incomes below that level, with the subsidies built on top of it. I think that's huge. I think in terms of our ability to manage the health of the private health insurance industry, which we are stuck, I think that we have considerable tools there to bring an end to the health insurance that really isn't there for us when we're sick, when all the practices, particularly in the non-group market, that undermine meaningful protection. So I think that the authorities to hold the insurance industry accountable, which I hope we will use to the hilt, are there in this law. When it comes to containing costs, I think containing costs is probably the hardest thing to do, and it's the ball game. Because if we don't do something to slow the growth of healthcare costs, then the subsidies in this law, as well as the Medicare program and existing Medicaid, are going to hell in a handbasket. So we really have got to do something about controlling healthcare costs. And contrary to much of the commentary, I think, short of putting a lid on the system, which people are not willing to do, that the authorities in this law for Medicare to become a more efficient, effective payer, and to start rewarding providers of all kinds for delivering quality care efficiently, those authorities are now there, and Medicare, where Medicare leads when they do so effectively, the private sector follows. And then we have a commission with the capacity to fast-track things through Congress, which is important in this respect because taking care and bailing out providers is a bipartisan proposition. That is, every delegation takes care of its providers at the expense of affordable and sometimes quality health care. So I think all those tools are there, and I would then add one more. We're talking to John McDonough, is often missed in the discussion of what this bill achieved, and that is truly a miracle because we have, in this law, established a public insurance program for long-term services and supports. And you're talking about a miracle. That advocate that I am for that initiative, and Steve McConnell and I have, we had some of us had more hair, some of us had browner hair at that working on long-term care. And if I'd known that the ticket to success was to achieve $70 billion in deficit reduction by pre-funding those benefits, we'd have had it a long time ago. But it truly is a miracle. It too is going to take real effort to make successful and stable, but we've got it, and that's huge.